If we go back 10 years ago, cancer survivorship was starting to become recognized as an important phase in one's life, an important time period in one's life. You had the 2003 Institute of Medicine report on childhood cancer survivors. You had the 2005 Institute of Medicine report on survivors of adult cancer. It really raised the questions and issues and said, are we doing what we can and should? And the subtitle of the 2005 was actually Lost in Transition. Patients finishing therapy were feeling lost in transition, going from on therapy to off therapy, and then that transition back to their primary care clinician. From the primary care physician's perspective, it simply has taken the amount of time for the number of cancer survivors to increase that it became a reasonable proportion of their practice, that they started asking those questions. What do I do with my breast cancer survivor? How do I follow my prostate cancer survivor? My Hodgkin lymphoma survivor that had their cancer at age 25 and now they're 45. Are there therapies that they had 20 years ago important for the heart disease that I'm seeing now? So as the number of cancer survivors has grown from 10 to 50, we're 13.7 to 14.5 million cancer survivors in the country now. We're moving towards 18 million. As that number has grown, just like most cancer survivors know somebody else that has cancer, likewise most primary care clinicians now have 5, 10, 15, 20 cancer survivors in their practice.